Thank you for joining the Teachers Retirement System Turning 65 webinar. I'm glad to be here to share information about Turning 65. Just to let you know, this webinar will be recorded and you should receive an email in a couple of days allowing you to view this recording again if you would like. The Turning 65 booklet is available in the handout panel. You may want to save that to your computer or just know it can also be found on the TRS website. Most of you are having a birthday in the next few months. In fact, a very special birthday. So first of all, I want to say happy birthday. Whether you are turning 65 in the next 2 months or 12 months, the process of enrolling in Medicare can be overwhelming. So during this webinar, I'm going to help you become more familiar with the process of enrolling in Medicare and the process of enrolling in the TRS Medicare Eligible Health Plan, also known as the MEHP. Hopefully help alleviate some of the stress and anxiety of this process. We will go over a series of slides explaining information you should expect to receive from teacher retirement, how to enroll in Medicare, give a high-level overview of the MEHP, and other miscellaneous but very important items. Keep in mind, these materials are geared toward those who are already retired and turning 65 in 2026. So if you are not currently retired or you are turning 65 after 2026, some of the information, benefits, and costs we discussed might be different or might not apply to you at all if you are not retired yet. During this presentation, jot down any questions that you may have. Often as we go further into the presentation, most of those questions will be answered. However, some things do come up that are not answered and you need some further explanation. After the seminar completes, if you have those outstanding questions and inquiries, please send your questions to info@trs.ky.gov or call our office at 1-800-618-1687. I will also give you this email address and phone number at the end of the presentation. So what should you expect? About 3 months before you turn 65, if not before, you should expect to be bombarded with mail and phone calls from insurance companies trying to sell you insurance policies for when you turn 65 and become Medicare eligible. Just remember, in most cases you will not need to look at any other information unless you expect to pay a premium for your TRS coverage and you would like to compare what we offer to what other companies offer. The majority of retirees do not pay a premium at all to TRS for their MEHP. But in the case of a spouse who pays full premium for the TRS coverage, you can compare other coverage to the TRS MEHP to see which one might be the best option for you. As I have said, you will probably receive a lot of mail during this time from all different sources. How will you know our materials from the others? The majority of the Medicare eligible health plan materials will be co-branded, and in most cases will have one or more of the logos you see here and the TRS logo. This should help you weed out that junk mail. We want you to become familiar with our partners' logos so you will know that if you get information from these companies, you will have confidence it is a TRS partner and not junk mail. Moving from left to right, hopefully you already recognize the TRS logo. Humana is our medical partner and Express Scripts is our prescription partner. Coriell Life Sciences Informed DNA is a company we partner with to provide a free, voluntary DNA genetic test to see how effective your medications are based on your genetic makeup. The Know Your Rx Coalition is a prescription coalition made up of a group of pharmacists who help with our prescription plan. And finally, our wellness partner that gives you a free gym membership at a participating gym, Silver Sneakers. We will be discussing more about these partners later. Each month, we send about 150 Turning 65 booklets through email and or mail. Who is going to get one of those notices about what to do when you turn 65? Only those people who are enrolled in health insurance through TRS prior to turning 65 should expect to receive a booklet. This booklet is emailed to you if you have a valid email address on file about 4 months prior to you turning 65. If you are not covered through TRS's health insurance prior to turning 65, you will not automatically receive this information, and you must either request this information from our office or obtain it online at our website listed on this page. Your enrollment materials must be received in our office no later than the end of the month before your 65th birthday month. One exception is if you were born on the first day of the month, we must receive your enrollment 2 months before your birth month. The TRS MEHP is composed of a Medicare Advantage plan administered by Humana and a Medicare Part D prescription drug plan administered by Express Scripts. This is what the Turning 65 booklet looks like. Included would also be an MEHP enrollment application and a postage paid return envelope. If you currently have your medical coverage through TRS and you have a valid email address on file, you will be sent an email about 4 months before you turn 65, and you can complete your enrollment online and paperless through our Pathway member self-service portal instead of waiting on that paper application. What will you find in the Turning 65 booklet and/or email that you received from TRS? There will be a quick step guide for enrolling in Medicare and the MEHP, an intro and description of the MEHP, information on transitioning from the KEHP to the MEHP, a benefit highlight of the plan, prescription flyer, what you need to do if you are currently covered by a family, couple, or Parent Plus plan. Do you need to do anything else like fill out another application? An MEHP enrollment form, which is on blue paper. This is not attached to the booklet and will be found with the booklet, but is the most important item that must be returned. This is also attached to the email that we send you. And then a return to TRS envelope. Before going into the details of the TRS MEHP plan, let's get to know a little about Medicare. If you didn't already know, Medicare is health insurance for people age 65 and older and people under age 65 with certain disabilities. It is administered by the Centers for Medicare and Medicaid Services, otherwise known as CMS. You enroll in Medicare by contacting either the Social Security Administration or the Railroad Retirement Board, whichever applies to you. Most people will contact Social Security to enroll, and Social Security will submit your enrollment to Medicare. Since Medicare gets their information from Social Security, if your name is spelled incorrectly at Social Security, your name will be spelled incorrectly on your Medicare card. So make sure all of your information at Social Security is correct when enrolling in Medicare. There are two ways to receive medical coverage through Medicare: Original Medicare and Medicare Advantage plans. Original Medicare was developed in 1965 to offer American seniors medical coverage and is still run today by the federal government. Original Medicare consists of two parts, Parts A and B, and Original Medicare was not designed to cover everything. Medicare would cover 80% of the medical claim, and you would owe the remaining 20%. So you would have to purchase additional supplemental coverage to help pay a portion of that remaining 20% to give you some protection. And Original Medicare didn't have prescription coverage. Then Medicare Advantage plans were developed as a result of the Balanced Budget Act of 1997. They are also known as Part C, and Medicare Advantage plans are run by private companies. These private companies provide your Medicare coverage instead of the federal government. You must be enrolled in Medicare to enroll in a Medicare Advantage plan. But you don't have to purchase additional supplemental coverage. Medicare pays a private company to pay and process your claims as primary and secondary, all wrapped into one. Those are the two ways to receive medical coverage through Medicare. So, what's the difference between getting your medical coverage through Original Medicare versus a Medicare Advantage plan? The main difference is the way claims are processed. So if you get your medical coverage through Original Medicare and a supplemental plan, when you go to the doctor, they submit the claim to Medicare, Medicare processes that claim as primary, and then sends it to the supplemental plan to process as secondary. If you get your medical coverage through a Medicare Advantage plan, your doctor just submits your claim to the Medicare Advantage plan that is run by a private company. There's no need to purchase supplemental coverage because the Medicare Advantage plan processes the claim as primary and secondary, all wrapped up into one. Often there's a misunderstanding that the MEHP is a Medicare supplement. However, the medical portion of the MEHP is a Medicare Advantage plan administered by United Healthcare. Remember, you must be enrolled in Medicare to be eligible to enroll in a Medicare Advantage plan. Medicare Advantage plans cover what original Medicare covers, and in many cases you get additional benefits. TRS has provided a Medicare Advantage plan since 2007, but if at any time in the future it is no longer financially feasible to continue a Medicare Advantage plan, we could move back to a Medicare Supplement plan. Now that you know the options for medical coverage through Medicare, let's discuss Medicare prescription coverage. The Medicare Modernization Act of 2003 introduced Medicare prescription coverage in 2006. Prior to then, Medicare did not offer prescription coverage at all. Medicare prescription coverage is also known as Medicare Part D, and the plans are run by private companies. Everyone age 65 and older must enroll in a Medicare Part D plan when you're first eligible to avoid a penalty in the future. The prescription portion of the TRS MEHP is a Medicare Part D prescription drug plan administered by Express Scripts. You do not have to enroll in a Part D plan outside of TRS. You will have Part D coverage through your MEHP. Now let's summarize. When you enroll in the TRS MEHP, you will have a Medicare Advantage plan administered by Humana that covers your medical claims. You will also have a Medicare Part D prescription drug plan administered by Express Scripts that covers your prescription claims. These are Medicare plans, and they are different from the pre-Medicare plans like the KEHP, and we want you to understand that the KEHP deductible does not transfer to the MEHP. It is also important for you to know that if you enroll in another Medicare Advantage plan or Medicare Part D plan outside of TRS, your MEHP coverage will be terminated. If you see a commercial on TV or think you are only enrolling in dental or vision, just be very careful. Be careful if you are also a retiree of another Kentucky public pension plan, because you will have to choose insurance in one place or the other. And many times retirees get confused and enroll in the wrong plan by accident, and then it can't be changed until the following year. Now that I've explained that you must have Medicare to enroll in the MEHP, I'm going to explain how to enroll in Medicare and the TRS MEHP. As soon as you open the Turning 65 booklet, you will see there is a quick step guide that explains the process in simple steps for retirees and spouses who are enrolling. The quick step guide is broken out by retiree and spouse and explains what to do if the retiree is enrolling or what to do if the spouse is enrolling in the MEHP. Really, the only difference is a spouse must have both parts A and B of Medicare to enroll in the MEHP, when the retiree only needs Part B of Medicare to enroll in the MEHP. Now let's discuss that a little further. Step 1 to enrolling in the MEHP is to enroll in Medicare. You will want to begin the process about 3 months before you turn 65. First, you will need to determine if you need to contact Social Security directly to enroll in Medicare, or if you will automatically get a Medicare card in the mail. If you are currently receiving Social Security or Railroad retirement benefits, you will automatically be enrolled in Medicare Parts A and B, and your Medicare card will be mailed directly to you. There is no need for you to contact Social Security to enroll in Medicare. But what if you are not in that situation and not eligible to receive Social Security benefits? You will not automatically be enrolled in Medicare and receive a Medicare card in the mail. You must apply for Medicare. Now, how do you apply for Medicare? There are a couple of ways. You can call or visit your local Social Security office, apply online at Social Security's website, or if you have Railroad retirement, call the Railroad Retirement Board. When you visit your local Social Security office, you will want to take items with you, such as driver's license, Social Security card, birth certificate, marriage license, proof of income for you and your spouse. Something important to mention is that once you enroll in Medicare, if at any time you lose your Medicare for any reason, such as a lapse in premium payment, your TRS MEHP will also be termed. This chart is broken down by retiree and spouse just for visual ease, but regardless, if you are a retiree or a spouse wanting to enroll in the MEHP, you need to first enroll in Part B of Medicare and pay the required monthly premium to Social Security. Everyone in the nation pays a premium for Part B of Medicare, and that premium is set by the federal government. Remember, this premium is not paid by TRS or deducted from your TRS annuity. The 2026 Medicare Part B premium is $202.90 per month. So everyone needs to enroll in Part B of Medicare. Just remember that. Part A is different, and if you are the retiree, only enroll in Part A if it is free to you. Most people automatically receive Part A coverage free from Social Security because you paid into Social Security or paid Medicare taxes while working. For example, if you started teaching April 1986 or later, you paid Medicare taxes and you would be eligible for Part A free if you taught for 10 years. So you might be in that category. But what if you don't fall into that category? There are other ways to qualify for Part A free. You might be able to qualify for Part A free through a spouse, an ex-spouse, or a deceased spouse. So make sure Social Security checks all the options for you to get that Part A for free. But retirees only enroll in Part A if you get it free through your own Social Security or through a spouse, ex-spouse, or deceased spouse's Social Security. If you are the retiree, it doesn't matter if you cannot get Part A for free. Your coverage through TRS will be the same as someone who has Part A. However, spouses are different. If you are a spouse wanting to enroll in the TRS MEHP, you must have Medicare Part A and B to enroll in the MEHP. This is shown in the middle section of this slide. Now, what about Part D? Whether you are a TRS retiree or a spouse, do not sign up for a Part D prescription plan outside of TRS. You will have a Medicare Part D prescription plan when you enroll in the TRS MEHP. As I mentioned, everyone needs to enroll in Part B of Medicare and pay the required monthly premium to Social Security. Once you are enrolled in Part B, how do you pay that premium to Social Security? If you receive a monthly annuity from Social Security, they will automatically deduct the Part B premium from that Social Security check. If you do not receive an annuity from Social Security, you will receive a quarterly bill for the Part B premium. You'll get a bill called a Medicare Premium Bill. This Medicare Premium Bill is a quarterly bill, and if you receive a bill, there are many ways to pay it and even get it set up on a monthly payment schedule. Pay by mailing in a check directly from your bank account through your bank's online bill payment service. Contact your bank or go to their website to set up this service. You can pay by credit or debit card through your secure Medicare account. And finally, you can enroll in Medicare Easy Pay to have your Part B premium automatically deducted monthly from a checking or savings account. You can go to Medicare's website to find out more about these options. If you are someone who is billed for your Medicare premium and for some reason you don't receive the bill and it doesn't get paid, your Medicare will be terminated and so will your MEHP through TRS. That's why we strongly recommend setting up some type of automatic premium payment. Just remember that premium is not paid by TRS or to TRS. That premium is set by the federal government and it is in addition to any premium that you might pay to us for your MEHP. Step 2 is to complete the MEHP enrollment form. This is a blue enrollment form that is sent with the Turning 65 booklet. You must complete both sides of the form. Let's go over the form so you can become familiar with it. The reason for application section at the top is normally pre-populated as Turning 65. The enrollment type section is where you will tell us who is turning 65 and enrolling in the MEHP. Is only the retiree turning 65, or are the retiree and spouse turning 65 in the same month? Or maybe even the spouse is only one turning 65. Next two sections should correspond to what you have told us is the enrollment type. Complete the retiree information section if the retiree is turning 65 and enrolling in the MEHP, and only complete the spouse information section if the spouse is turning 65 and enrolling in the MEHP. If the retiree and spouse are both turning 65 in the same month, you can complete both sections. It just depends on who is turning 65 and who is enrolling in the MEHP coverage. Also note there is a waiver of coverage section at the bottom. Check the box to waive the coverage if you do not wish to enroll in the MEHP when you turn 65. The back page of the enrollment form is where you put your demographic information, your Medicare information, and of course this is where you'll sign the form. You will use your Medicare card or the Medicare information you receive from Social Security to complete the top sections of the enrollment form. If you do not have your Medicare card, you must obtain your Medicare claim number or effective dates of Medicare Part A and or B from Social Security Administration to be able to complete the MEHP enrollment form. If you do not have this Medicare number, you cannot submit your enrollment form since this number is needed to complete the enrollment process with the insurance companies. So you will need to make sure you obtain your Medicare claim number in enough time to submit this form to TRS by the last day of the month before you turn 65. Otherwise, you will have a lapse in coverage. If you have applied for Medicare but don't have a card yet, Social Security might be able to tell you what your Medicare claim number is going to be so you can put it on your enrollment form. Next, you will complete the demographic information section. If your mailing address is a P.O. box, you must complete the permanent address section with your actual street address. This is a Medicare requirement. Then, if you need to update your address in the future, that must be done in writing to TRS. We will then update the address with the insurance companies. Finally, do not forget to sign the form. If the spouse is enrolling, the retiree and spouse must both sign the form. Step 3. Upon completing the enrollment form, submit it to TRS. You should also submit a copy of your Medicare card with that enrollment form if you have it. Forms should be submitted to TRS about 2 months before your 65th birth month, but no later than the last day of the month before you turn 65. For example, if your birthday is October 16th, we need your enrollment form by September 30th, so your enrollment can be effective October 1st. There is an exception to this rule. Those of you who were born on the first day of a month, you are an exception to that rule. You must submit it 1 month earlier because your Medicare will become effective 1 month earlier. If you were born on October 1st, your coverage will be effective September 1, and we will need your application by August 31st. If you didn't know already, the retiree can log into their Member Self-Service Pathway portal from our website and enter the retiree or spouse's enrollment. Enrolling online is the fastest way to get your enrollment to TRS. As I mentioned, the retiree can log into their Member Self-Service Pathway portal from our website and complete the MEHP form for the retiree or the spouse. You can access all the instructions in the Turning 65 booklet. Registration is super easy, and I would recommend you register for Pathway now if you haven't already. We encourage paperless enrollment, and we will be there to help you if you need us as well. If you don't have an email address on file or your TRS ID, just call our office and we can help you with that. Step 4 is for those of you who are on any plan other than a single plan. So if you are currently covering dependents on the KEHP through a family, couple, or Parent Plus plan, you might have one more step in your enrollment than someone who is on a single plan. The Turning 65 booklet will walk you through whether or not you need to complete the KEHP application that is in the booklet in addition to the MEHP application. For example, if the retiree is turning 65 and currently on a couple plan, that retiree will need to complete the MEHP application for the retiree to enroll in the MEHP and the KEHP application to drop down from a couple plan to a single plan to continue coverage for that spouse, or complete the KEHP app waive the coverage for the spouse. If that application is not submitted, we won't know if you want to continue coverage for your under age 65 spouse. That is something that can also be done through the Member Self-Service portal, but you would have to make sure you complete the retiree enrollment first. If you are on a Parent Plus plan, your child cannot continue coverage through TRS unless that child has Medicare. However, you can continue coverage for that child through COBRA and should receive a COBRA packet from Health Equity. So those are the steps to enrolling in Medicare and the MEHP. Let's move on to a brief overview of the MEHP medical coverage. The medical coverage of the MEHP is a Medicare Advantage plan administered by UnitedHealthcare. A summary of benefits can be found in the Turning 65 booklet. With this plan, you are subject to a $150 deductible each calendar year for medical expenses. Upon satisfying the $150 deductible, you will pay 4% coinsurance and the plan pays the remaining 96%. You also have a $200 inpatient hospital copayment each time you are admitted to the hospital. The good news is, all of these amounts you pay apply toward your maximum out of pocket, which is $1,200. What this means is $1,200 is the most you will pay out of your pocket for covered medical expenses in a calendar year. At that point, the plan pays 100% of covered medical expenses. With this plan, all preventative services are covered at 100% with no deductible to meet. Remember, a Medicare Advantage plan must cover all of the same benefits as original Medicare, but you will also have some extra benefits over and above what original Medicare covers, such as coverage for routine hearing and vision exams. Also, there are certain rewards for completing healthy activities. As I mentioned, there are some additional features with a Medicare Advantage plan that you receive that are over and above what original Medicare covers. Just to mention a few listed on this slide, you'll be able to get a free gym membership through Silver Sneakers, the ability to earn rewards through the Go365 Rewards program, a free personal emergency response system, one free hearing exam per year, and a $500 hearing aid allowance for each ear every 36 months through True Hearing, along with one free vision exam per plan year through iMed. Please review the materials you receive from Humana to learn more about these features and the rewards for healthy activities. Let's review the MEHP prescription coverage. It is a Medicare Part D prescription drug plan administered by Express Scripts, and an overview can be found in our Turning 65 booklet. The prescription plan is composed of two plans, and you can use both of these plans. One is a retail pharmacy program, and the other is a mail order program. The retail pharmacy program is designed for a short-term 30-day supply of medication. With the retail pharmacy program, you do have a $150 deductible per calendar year. You give the pharmacist your Express Scripts ID card, and you will pay the first $150 before the plan will pay anything. After you pay the $150 deductible, you will pay a percentage of the cost of the medication depending on the tier the medication falls in. For medications in Tier 1 and 2, you will pay a 20% coinsurance, and if you take a medication that falls into Tier 3, you will pay a 50% coinsurance. So you definitely want to try to avoid Tier 3. There is also a mail order program that is designed for maintenance medications that you take on a daily basis. You can get up to a 90-day supply of medication by ordering it from Express Scripts mail order pharmacy, and it is delivered straight to you. Using this option for your maintenance medications will save you money because you are not subject to the $150 deductible, and you pay a flat copayment depending on the tier. For example, you can get up to a 90-day supply of a preferred generic for a $10 copay with no deductible. Although not all medications can be filled through home delivery, using home delivery when you can saves the retiree and the system money. As you saw on the previous slide, the plan consists of 3 tiers, and you will pay 50% of the cost of the medication if your medication falls into Tier 3, which is the tier for non-preferred medications. If you take a medication that falls in Tier 3, or you take a medication that is not covered by the TRS plan, we have a group of pharmacists that can help you maneuver through the new prescription plan and work with you and your doctor to find an alternative. This group of pharmacists is known as the Know Your Rx Coalition. These pharmacists can answer your questions about your pharmacy benefit and/or copayments, as well as address any concerns with new or existing prescriptions, such as potential side effects or interactions. They can also help you get set up on the mail order program. They are your liaison between you and your prescription plan with Express Scripts. You can call them anytime at the number listed on this slide. They are also who you would talk to about your results if you participate in the TRS Personalized Medicine Program. Let me tell you about what led TRS to begin this personalized medicine program that has become so very popular with our retirees. When we learned that 50% of medications people take are ineffective and over 2 million people are hospitalized each year due to their prescription medications, we partnered with Coriell Life Sciences, who was recently acquired by Informed DNA, to allow you access to a free DNA test kit. This is free once you enroll in the MEHP. Your DNA is analyzed and sent for a review to the Know Your Rx Coalition pharmacists, who will then call you to discuss your results. Your information is private and is not shared with anyone other than the coalition and your physician. TRS does not even have access to your data. This is something that can truly be life-saving. This is a slide from the Know Your Rx Coalition. It has compiled the 20 most used drugs by TRS members and also the 20 top disease states for TRS members. If you use any of these medications or have any of these disease states listed, then the DNA test would be very beneficial for you. So once you're on the MEHP, call to sign up and get your free test kit. Now I'm going to give you a quick overview of the MEHP. With the Humana Medicare Advantage plan, you can go to any doctor or hospital that accepts Medicare and agrees to bill Humana. When you go to the doctor or hospital, you will give them your Humana card. Unlike what you might do now, you should not pay the doctor up front. The doctor should submit the claim to Humana, and you should get an explanation of benefits from Humana telling you what went toward your deductible or what you owe, and you will receive a bill from your doctor. The amount you owe the doctor should match the amount the Humana explanation of benefits shows as your responsibility. With the Express Scripts Part D prescription plan, you can go to any major chain pharmacy to obtain those prescriptions. You present your Express Scripts ID card at the pharmacy and you will pay the first $150 before the plan pays its portion. Or remember, you can contact the Know Your Rx Coalition for help in setting up the mail order home delivery for your prescriptions and avoid that deductible. After TRS submits your enrollment to Humana and Express Scripts, you can expect to receive benefit booklets and also ID cards like the ones shown here. You present those ID cards to your providers, not your red, white, and blue Medicare card. You will not need to carry your Medicare card with you because you will not need to present your Medicare card at the doctor's office. One important thing to mention, we love it when you send in your enrollment early, and we encourage you to do so. But we do not send your enrollment to the insurance companies for processing until the first week of the month before your 65th birth month. So if you have submitted your forms early, you still should not expect your ID cards until the middle of the month before you turn 65. However, you should expect to get your ID cards before the first of the month you turn 65 if you have submitted your correctly completed enrollment to our office and your Medicare enrollment is completed in a timely manner. What will the MEHP cost? Let's talk some premiums for the MEHP. How much will the MEHP cost you in 2026? This chart breaks down the cost of the MEHP based on the retiree's TRS entry date, which is when you started contributing to TRS as an active employee, and years of retirement system service. The majority of our retirees do not pay a premium to TRS for the MEHP. If you owe a premium, it will be deducted from your TRS annuity at the end of the month. So if you turn 65 in May, you will see a change in the premium from the KEHP to the MEHP on the check you receive at the end of May. This TRS premium is in addition to the Part B premium you have to pay to Social Security. Remember, the Part B premium is not taken out of your TRS annuity. You must pay it directly to Social Security. And also remember, spouses pay the full premium rate shown in the last column of the chart. For 2026, the premium for the MEHP for spouses is $200 a month. If you are unsure of where you fall on this chart, or you are also retired in another Kentucky public pension system, please contact our office and we will help you calculate your MEHP premium. Are there any premiums in addition to what you might pay TRS for the MEHP and Part B premium upon turning 65? There could be if you don't enroll in Medicare Part B and/or D when you are first eligible. You will be required to pay a late enrollment penalty to Social Security. It is also important to mention that if you fall into a higher income bracket, you might be required to pay an additional Part B and Part D income adjusted premium to Social Security. These amounts are in addition to the standard Part B premium amount paid to Social Security and the MEHP premium paid to TRS. If you fall into either category above and have to pay extra premiums or a late enrollment penalty, you should receive a notice from Social Security informing you of this. What happens if you or your spouse decide to waive the MEHP upon turning 65? There are different consequences to each decision. Any retiree who waives the MEHP can enroll during open enrollment for the effective date of January 1. A retiree could also enroll outside of open enrollment if you experience a qualifying event, such as loss of coverage. However, a spouse who waives the MEHP upon turning 65 will only be eligible to enroll upon experiencing a valid TRS qualifying event, such as the loss of employer or retirement system sponsored coverage. Spouses are not eligible to enroll during open enrollment, and the qualifying events are life events that might be uncommon for most. So please make your enrollment decisions based on this information. A list of qualifying events can be found on our TRS website. The MEHP has an open enrollment yearly, but if you are already enrolled in the MEHP, you would not need to re-enroll each year. A retiree would only need to re-enroll during open enrollment if they had previously waived coverage but want to enroll for January 1. It is hard for me to believe that after 27, 30, or even more years of teaching, you would want to go back to work. But I'm amazed at how many of you do return to work, and thank you for all you do and the hours you volunteer as well. Retired teachers keep very busy. So if you do return to work, remember certain rules apply when you return to active employment. Bottom line, boxes 1 and 2 say if you are actively working and you are eligible for insurance through an employer that participates in one of the Kentucky State Retirement Plans, you must terminate insurance coverage through TRS. Once you terminate that employment, you are eligible to come back on the MEHP within 30 days of the loss of your employment insurance. But it is your responsibility to contact TRS to re-enroll and not miss your opportunity. Before you move from the KEHP to the MEHP, remember that your Wellness Program incentive points and your Health Equity HRA account funds do not continue to the TRS MEHP, so you must use them or you will lose them. We want your transition from the KEHP to the MEHP to be smooth. If you have participated in the Wellness Program and you still have points left to spend, we want you to know you must spend them before your under 65 KEHP terminates and your MEHP plan begins. You don't want to lose out on those valuable bucks that you have worked so hard to accumulate. Also, if you are enrolled in a consumer-driven health plan and you have any HRA funds remaining on your health equity card, you should use those funds before moving to the MEHP. Living longer is something that retirees have gotten very good at, and that's why we're so happy for our defined benefit plan. Actually, you're living much longer, you and your peers. TRS has more and more retirees over age 80 each year. As you can see on this chart, as of December 31st, 9,920 retirees were over the age of 80, and 46 were over the age of 100. For that reason, we do our best to keep benefits and costs consistent. They have been consistent in the past, but they can change on an annual basis. So keep in mind that the information given today is based on the 2026 calendar year benefits and costs. A few things that might change are the deductibles, co-insurance, and co-payments. Your formulary list, which is a list of preferred prescription drugs, will always change on a yearly basis. Medications move from preferred to non-preferred, and sometimes it is a positive move, in which a non-preferred medication moves to a preferred medication. But premiums will always change. The MEHP premium and also the Part B premium set by the federal government change on an annual basis. Always watch your TRS newsletters and mailings for notifications of these changes. And here's how you can follow us online. We're on Facebook and X, which formerly known as Twitter, as well as the TRS website and pathway. Those links are listed on the slide. We want our members to stay informed. TRS does not send out junk mail. You can call our information center, check our website, and always watch for our newsletters. Please try to read those newsletters and watch for any updates we might announce. The best way for us to get information to you that is for you is through those newsletters. Also, Pathway is your online access to your TRS account. If you want to access your personal account, you must register. If you are a first-time user, you will just need your TRS ID to register for the Member Self-Service Portal. That ID is on your annual statements or any personal mailings we send you. Of course, if you don't have it, feel free to call us and we can get that ID to you. I hope this webinar has been beneficial and will help make things go a little more smoothly with your transition to Medicare and the Medicare eligible health plan with the Teachers Retirement System. Always feel free to contact our office. We are open 5 days a week from 8 to 5 Eastern Time by phone or appointment only. And remember, if you have any questions or need any additional information about something we have covered, you can email us at info@trs.ky.gov. We appreciate your time today, and as always, thank you for being a Kentucky educator.